thank you so much for coming. This means a lot. This support means a lot to us. So much of what has already been said is exactly how I feel standing here. But I'm going to build on from a lens of a chief medical officer who's going to be serving at this hospital. Before any title, I am a physician, and that's where my heart is. I've had the privilege of working with families and individuals in their most vulnerable moments, and I have bear witness to the struggles, the resilience, and hope. That's what grounds me to my work. That's why I come to work every day. A combination of professional experience. I've worked in the community for close to 3 decades. In addition to professional experience and how lessons of life shaped my own personal life, I've learned something really important. Mental health affects everybody, every community, every family, every walks of life, in one way or the other. When you truly see that, when you understand what vulnerability means, you don't just practice medicine. You commit to compassion and purpose. That's what feeds my soul. I've had the privilege of working in this community and the neighboring community close to 3 decades now. I understand the strengths that this community has, and I also understand the gap in, especially when it comes to serving the needs of the mental health clients in the community. What we are building here is meant to directly address that. As a chief medical officer, my responsibility is to make sure every person who walks through our doors receives care that is evidence-based, coordinated, and patient-centered. This level of care requires disciplined, coordinated care by our physicians, nurses, therapists, behavioral techs, facility operators, care manager, working together with clarity and purpose. It requires shared accountability of outcomes, and it requires a structure that supports collaboration. It also means recognizing that a care for an individual is not restricted to these walls. It doesn't begin and end within the walls. Recovery is not linear and does not happen in isolation. That is why I'm a big advocate for continuity of care, expanded services that allows us to stay connected with the patients as they walk through the journey in their treatment, and strong partnership across the community to ensure support is consistent and accessible. So today is start with promise that we will deliver high quality care with discipline and consistency, that will stay connected to community and responsive to its needs, and that we will earn the trust of the individuals we serve. Thank you for your partnership.